Kentucky Senator Rand Paul, who is also a doctor, is back in action volunteering at his local hospital now that he is fully recovered from coronavirus. He joins us right now for his first interview since recovery. We're also joined by Fox News medical contributor, Dr. Mark Siegel. Good morning to both of you. Dr. Senator Paul, let's start with you. This is a new look for you. I don't think I've ever seen you with a beard before.
Well, you know, they banished me to the basement. They did agree to feed me, but nobody would send a razor down. So I guess this is what I got from my quarantine beard.
Yeah. Dr. Siegel is going to have a question for you in a minute. But first, let me ask you, how did it feel to have coronavirus? And what did it feel like to the point where you thought to yourself, you know what, I think I'm over it?
Well, you know, in my case, I had an extraordinarily mild case. I had no symptoms, never had a headache, never had a body ache, never had a fever, never had a cough. I didn't really have any symptoms. In fact, I would have never gone to the hospital had I not, or not to the hospital, I would not even gone to the doctor's office had I not known this was about and that I had been traveling so much. So it's a bizarre sort of situation that some people get very, very sick, you know, even die from this, and some people get no symptoms. They've tested people in Iceland where they've tested, you know, a large body of the population of Iceland, and they've found that about 50% of the people who are positive have no symptoms. And so there's something about this illness that's not just the illness, but your immune response to it. And it may be some sort of genetic thing that some people are genetically predisposed to a overwhelming immune response that ends up making the patient very sick with their lungs filling up with fluid. And then other people like myself get virtually no symptoms.
All right. Dr. Siegel.
Senator Paul, I want to ask you something a lot of our viewers don't know about you. And I know you're too humble to say this yourself, but you go around to underserved areas and you perform eye surgery. You're an eye surgeon, an ophthalmologic surgeon that saves vision for a lot of people. And it's something you do that you don't highlight enough. So how does it feel to now volunteer in a COVID-19 ward, taking care of patients with COVID-19 after having had it yourself? Does that put you in a better position to address it, to communicate it, to know what they're feeling like?
You know, I spent about 20 years in medicine, mostly doing eye surgery, but I was also an ER physician as well as someone who spent a year doing general surgery. So I've been in and out of medicine my whole life. I miss it. It's great to be back working with local doctors, some of whom I knew when I was in private practice here, but some of whom are new and younger, and I've gotten to know some of the hospitalists. When I was in practice, there weren't many hospitalists. These are doctors who practice primarily in the hospital, and that's who I've been working with in the hospital. Because I now have immunity, I can't catch it, presumably. I have the ability to go into rooms more often. I have the ability to talk to some of the patients and maybe spend a little more time that anything I can do to prevent a trip of either a doctor or a nurse into the room is helpful to them. It's also, I try to be encouraging to the patients just from a moral standpoint. Some of the patients I've been with, the biggest thing that bothers them is they can't see any family. Their family's not allowed to visit them in the hospital, and that's hard on people, young or old.
Sure. Senator, let me ask you this. After it was revealed that Mark, let me ask him one quick question. After it was revealed that you were testing positively, some of your fellow senators said, wait a minute, we just saw him at the gym. What's your message to the senators who thought that you should not have been there?
I think the facts are important. I was told by the Louisville health authorities that I didn't need to quarantine. I followed explicitly the doctor's advice to a T. I was asked not to quarantine or test. I didn't follow that to a T. I went ahead and got tested, but I was not asked to quarantine. In fact, I went to a large charity event with 1,000 people there, and they told everyone there, unless you had contact with the one woman who was positive, you didn't need to be quarantined. So I think some of these people overreacted, and I think that's true of the country. People are scared and frightened, and when people are frightened, they don't always think about the facts. They just get mad.
Sure. All right, Mark.
Quick question. Senator, there's been a lot of government overreach in all of this. I'm sure you agree. How about physicians taking the lead on what to prescribe, like hydroxychloroquine, other treatments? How about the issue of public gatherings where there was the governor saying they're going to let, as you famously said, you know, the governor is saying they're going to track people who went to church yesterday. How do you feel about the government involvement versus the role of the physician in all of this?
You know, I think like the governor in Michigan, it's her ignorance and her hatred of Donald Trump that caused her to say really ridiculous things. Doctors for really since the beginning of modern medicine have prescribed drugs that are called off-label. It's very expensive to get a drug to be applied to a certain purpose. So if it's already approved for one purpose, like the anti-malarial drug hydroxychloroquine, it's also used for lupus and a variety of other things. Probably half of these other diseases don't have a specific indication because it costs so much money and time to get the FDA to do it. So it's not unusual to use something like an anti-malarial drug for rheumatoid arthritis or lupus, but it's also not that unusual to find a new use for it like we've found with the virus. Right. I can tell you that locally, when we've had patients that are sick, they are getting the hydroxychloroquine, and there's at least anecdotal evidence that seems to be working and helping them.
And that is a conversation a lot of patients are having with their doctors. Dr. Siegel, thank you very much for joining us live from your studio.
Thanks, Steve.
And Senator Rand Paul, thank you very much for joining us from wherever you are out there in Kentucky.
Thank you.
All right. Good luck to you. Glad you're on the mend.